Hello, my name is Marius, so I'm the group leader on our group. So we choose the topic to discuss about mental health and childhood and adolescence. So first of all, we're gonna start with the introduction. So mental health is the emotional and the psychological well-being of children and young people, helping them and to develop, build relationship and manage life's challenges. So another point that I want to show is the importance in health and social care. So mental health is important because it affects a child or young person in overall to development, learning, relationships, and physical health. What does that mean? Health and care and social care is important because it's help to maintain the quality of life by providing supports, treatment, and care. So another point that I want to show and to discuss is like early identification and support can prevent mental health problems, especially on the young people or the kids, because they really need support when they are very young.
Hi, my name's Nicola Knight and these are my 3 slides on mental health during pregnancy and birth. So the first slide, mental health begins before a baby is born. During pregnancy, a mother's emotional well-being can influence the baby's brain development and future mental health. Conditions such as stress, anxiety, depression may affect both the mother and baby, which is why recognising and supporting mental health during pregnancy is so important. Yeah. And then mental health in the early years, age 0 to 5 years. Slide 2. The first 5 years are critical period for emotional development. Babies build secure attachments when caregivers respond consistently to their needs, helping them feel safe and develop trust. Positive relationships, good nutrition, sleep and play contribute to a healthy mental well-being, while experiences such as neglect or ongoing stress can have a negative impact. Supporting positive mental health in the early years. Slide 3. Parents, health professionals and early years settings all play an important role in supporting children's mental health. By reckoning concerns early, providing nurturing relationships and offering appropriate support, we can help children build resilience, confidence and healthy and emotional development that benefits them throughout life. And that's it.
Good morning everyone, my name's Deborah Brown and I'm studying health and social care at the University of Suffolk. Today I'll be talking about mental health in adolescence because it is a time of incredible change. Our brains and bodies are growing fast, but this transition makes young people highly vulnerable. Today, roughly 1 in 7 teenagers experience a mental health condition. In fact, these challenges make up 15% of this age group. Lately, we are seeing a sharp rise in emotional distress, with anxiety becoming the most common issue. We must understand these young people at what they are facing. So what are the most common challenges? Firstly, it is anxiety. This is not just everyday nervousness, it is intense, constant worry or panic that stops a teenager from enjoying school or making friends. Second, it's depression. This shows signs of extreme tiredness, feelings of hopelessness and losing interest in things that they loved. Finally, maybe conditions like ADHD can cause severe struggles with focus, making school and daily life feel completely overwhelming. Adolescents face heavy pressure to fit in. They explore their identity, get good grades. On top of that, digital life plays a huge role. Research shows that using social media for more than 3 hours a day is heavily linked to poor sleep and higher anxiety. Finally, biology matters. The rapid hormonal changes of puberty create sharp differences. For example, teenage girls become twice as likely to experience depression as boys. Because teenagers can hide their feelings, we must look for warning signs. A major sign is social withdrawal, suddenly pulling away from friends and family, isolating themselves in their room. You might also notice physical signs like constant headaches, stomach aches, major changes in sleeping and eating patterns, and in severe cases, young people might turn to risky behaviours. Unfortunately, vaping, drinking, self-harm, simply to cope with the pain inside. The good news is that we can help. The path forward starts with early intervention and talking openly to remove this stigma. Proven therapies like cognitive behavioural therapies, practical tools to manage their thoughts. At home, we can protect them by encouraging simple, healthy habits, regular sleep, physical exercise, and a safe place to talk. By listening without judgment, we can save lives.
Hello everyone, my name is Alexandra. Today I'm going to speak about mental health problems in children and adolescents in the UK. Mental health problems are becoming increasingly common among young people, affecting their emotional well-being, education, relationships, and future opportunities. I'll briefly explain the poor mental health and why early intervention is so important. Recent UK research shows that 1 in 5 children or adolescents are experiencing a mental health disorder. Anxiety and depression are among the most common conditions, particularly during adolescence. Mental health has become an important public health issue and highlight the growing need for effective support services. There are many factors that can affect a young person's mental health, including family difficulties, bullying, social media, financial hardships, and traumatic experiences. Early identification and intervention are essential because they improve well-being, help reduce the risk of mental health problems continuing in adolescence. Health professionals, schools, families, communities all play an important role in supporting children and young people. Thank you for listening.
Hello everyone, my name is Solange Vieira. The impact on child and adolescent mental health. Benefits of good mental health in childhood and adolescent is the foundation for everything. It's not just about not having problems. It means being able to grow, learn and feel good about yourself. When mental health is strong, young people build the skills they need to do life, full value, and connect well with others. Benefits for their life. We see clear benefits every day. Young people focus better at school, hand and pressure, calm and bounce back when things go wrong. Strong mental health now lowers the risk of problems later in life, helping them become confident, capable adults. Benefits for society. Support mental health early is smart and kind most lifelong. Challenges begin in these years, so getting help no stop big problems later. It also creates a greener world where every young person gets the key to their best. The conclusion to finish mental health is in childhood and adolescent shapes the rest of your life. Investigating it is one of the most important things we can do by listening, offering support, and acting early. We give young people the best start. Together, we can build a future where all children and teenagers feel safe, valued, and able to reach their full potential. Thank you.